Great. Well, listen, you're all very welcome here this morning. Thank you for joining our webinar on Mastering Psychosocial Risk Assessment with Work Positive. I'm Aoife Sweeney. I'm Programme Manager with the Health and Safety Authority. And I'm delighted to act as our chairperson today for our discussion. So just to let everybody know, the session today will be recorded, so it will be available after the event for if you want to kind of review it again or pass it on to your colleagues. So we'll get started now. Some people will be still joining, but we'll kind of start off now with our presentations and let people join as they log on. So today's session is being brought to you by the Health and Safety Authority in collaboration with the State Claims Agency and WellHub. Our aim today is to share with you insights on psychosocial risk assessment, its role in health and safety management, and in the promotion of workplace well-being. As you know, workplace stress and mental health challenges are growing concerns in today's professional landscape. According to the International Labour Organization, anything in the design or management of work that increases the risk of work-related stress can be considered a psychosocial hazard. Our goal today is to help you understand and effectively manage these risks to foster a safer, healthier, and more productive work environment. Work Positive CI is a free, confidential, and structured psychosocial risk management tool that provides insights into workplace stress, employee well-being, and exposure to critical incidents. This tool offers structured guidance and action plans, helping organizations identify risks and opportunities while ensuring compliance with health and safety legislation. Today's session will cover a review of psychosocial risks and their impact on workplace safety and employee well-being, an introduction to the four-stage psychosocial risk assessment process, along with an understanding of how Work Positive CI supports legislative compliance in workplace health and safety. And finally, we will share practical applications, including a sample report and feedback from organizations that have successfully integrated Work Positive CIs in their organizations. So I'm delighted to introduce our panel of experts joining us today. First, we have Brian Larkin, who's the Senior Enterprise Manager in the State Claims Agency, Dr. Robert Kerr from WellHub, and finally, Elaine Murphy, who's Senior Inspector and Organizational Psychologist with the HSA. So I'm going to hand over to Elaine first, who will discuss psychosocial risks and their impact on workplace safety and well-being. Thanks, Elaine.
Great. Thanks, Aoife, for that. Good morning, everybody, and I'm delighted to be here today to chat to you about what are psychosocial hazards in the workplace. The term psychosocial hazards can be very confusing, can be very challenging because they are difficult to measure. So I suppose it's really good to have a very simple, clear definition, and one that I use a lot and taken from Australia is a psychosocial hazard is anything that can cause psychological harm to a person in their workplace. So I suppose as you as employers, as HR managers, you're looking for those root causes of psychosocial hazards and what they are. Very much today, looking at Work Positive, we highlight these psychosocial hazards and look through each one of those individually. So what do they mean? When you're looking at your workplace, excessive job demands, you can have workers who are under sustained or intense pressure from a physical side, a mental side, or an emotional effect. Examples of that can be people in the construction sector working physically difficult jobs for long periods of time, people in healthcare sectors working emotional jobs that are very difficult and intense, and obviously as well that mental side. It comes to mind the air traffic controller. So those excessive job demands in the workplace and how they can, over a prolonged period of time, cause that really impactful stress to jobs, to people. Low job control. This is something as well that I suppose people can have little control over their job. They're not clear on what their job is and can cause an awful lot of stress for people. Poor manager support is also identified. So I suppose in terms it can be poor management support that you don't have the resources or the equipment to do your job, or from that support that you don't have that line manager or that training or that development support for you within your organization. Poor peer support, that can be that your organization doesn't really support that peer-to-peer co-worker, or that you very much feel alone in your job and what you're doing. The next hazard really in terms of conflict or poor workplace relationships and interactions is very broad. It can be the conflict on a day-to-day basis. It can be bullying, which is prolonged over a period of time, which can cause stress within the workplace. Again, the lack of role clarity is something that we've seen a lot of, particularly in changing roles, changing times, how we work. People, their roles are unclear, they're inconsistent or frequently changing. The responsibilities or expectations are moving feast all the time. So that can be very stressful for people. I think something that has come to the fore again is poor organizational change management can certainly be a hazard within the workplace. How we can have policies and procedures, but it really is the communication with staff and the training of staff in relation to how we're going to manage change or move forward with change. And obviously as well, trying to identify the benefits that can be done by change, but also if there are negatives, how we manage and cope with those as well. Critical incident exposure, another hazard, can really relate to witnessing, investigating, or being exposed to traumatic events or material. We see a lot of that in the ambulance sector, healthcare sector, but again, it can be across all sectors. So definitely these are the hazards in the workplace. Some of them are unseen, but definitely this list is not exhaustive, but these are the main ones that we are looking at. I suppose the next slide here relates to the effects of psychosocial hazards in the workplace. And I suppose as an employer or a HR manager, you're trying to get to grips with obviously, how is that affecting my workplace? How am I going to look at it? How am I going to manage it? So really you're looking at the chronic imbalance between the work demands and the ability to cope with them. So it's really interesting when we see the American Journal there of Industrial Medicine, very recent research from June 2024, highlights the top 5 effects of psychosocial hazards in the workplace. So really they're absenteeism, increased accidents, alcohol and drug use, anxiety and behavioural disorders. So in terms of that, some really devastating effects can have on your workplace and obviously the output of your workplace, of the work that you do in terms of not managing psychosocial hazards. And I suppose research will tell us as well the physiological measures, the increased stress and pressure over time, they call it an allostatic load, that cumulative stress over the time can lead to such chronic diseases. But I suppose the good news here for us as well is to look at research is also telling us that controlling psychosocial hazards will reduce or prevent adverse physiological and psychological outcomes. So very much again, noting the effects of hazards in the workplace, but we can do something about them and we need to do something about them. The challenge of managing psychosocial risk, you'll all be very familiar with EU OSHA, and they have an excellent definition of psychosocial risks, and it's expanding all the time. So we can see here very much the consequences for, trying to manage psychosocial risks within the workplace. And you see here within the definition, the detrimental effect on individual health. Psychosocial risk can also negatively impact the efficiency of organizations as well as national economies. They have some very interesting research from EU OSHA have identified that over every month that employees can lose between 1 to 2 days due to illness or what they actually identify as limited activity. So this could be you're in your job, but you're actually not doing your job. So again, it's that unseen psychosocial risk that is caused within the workplace as well, that really it's quite extensive, the impact that it can have. we've research from our colleagues in the HSC UK that tell us that 71% of European workers report suffering from related stress at least once a week. So again, the challenge there is enormous. But again, I suppose we are equipped with the tool to try and assess it, to identify the risks and try and mitigate those risks. So I suppose it's important then to look at what employers can do. And I think it's a very nice graphic there that you'll all be familiar with in relation to risk assessment. Certainly we have section 19 of the Safety, Health and Welfare at Work Act, which identifies that employer must do a risk assessment for hazards in the workplace. And obviously we have identified a number of psychosocial hazards. So how do you go about that? And again, it's lovely that this graphic on the right is encircled with consultation. And I really can't emphasize that enough, because when we do inspections for psychosocial hazards, we do see that there's a lot of policies, there's a lot of procedures in place, but maybe that element that is missing is the consultation with staff, the training of staff, and that communication with staff. So it's really important that the hazards that you identify from the psychosocial hazards are done in conjunction with staff, with team leaders, with people working every day, that you try and assess those risks and control the risks. And really important as well that this is reviewed on an ongoing basis. And again, as I said, it's a difficult process, it's a long process, but I think definitely a process that is very worthwhile for both employers and employees. This is another very interesting piece of research from the Occupational Safety and Health National Institute there. It's very recent research, and it really identifies 5 things that employers can do. And I'm just going to give you some examples. I mean, you will appreciate we're the Health and Safety Authority, so we work across a number of sectors from construction to agriculture, healthcare. So we have a very broad remit. So if you're looking at an employer in any of those areas, your actions will be different. So the NIOSH recommends the first thing that employers can do is to eliminate negative working conditions and barriers to safety, health and well-being. So that could be removing hazardous material or outdated equipment that pose safety risks, address this excessive workload and unrealistic deadlines, implementation of anti-bullying policies to foster a more positive workplace, or it could be even ensure proper ventilation, lighting and temperature. So there's a broad range there, a broad remit. The second thing that they recommend is very much substituting safer and healthier workplace policies, work processes and practices. So again, that can be something to replace manual lifting tasks with mechanical lifting, very much introduce ergonomic furniture, ergonomic practices within your work environment, or implementing flexible work schedules. So again, a variety of actions that can be taken there. The third action, redesigning the work environment to enhance working conditions and improve safety, health and well-being. Very much, I suppose, it seems basic enough, but installing proper signage, safety barriers, not often done in some workplaces. Very much review workspace layouts to reduce congestion and create dedicated breakout spaces for people to promote rest and recovery, particularly after a difficult shift or a difficult interaction. Really important to assess that. Improve accessibility features for employees with needs within your organisation. And that's also key. The individual differences between our employees and employers, and that also needs to be taken into account. Number 4 speaks to educating all employees and provide resources for improved knowledge. So again, that comes back to conduct regular safety and training workshops, and workshops again that are highlighted as key important things for your employees. You might do an employee survey and they identify that they'd like a workshop on reduction of stress management. So again, in consultation with your employees, identifying that training that's going to be useful and practical to your organisation. And number 5 there, encourage or reinforce adoption of safe and healthy practices. So ensure, I suppose, very much again that there is a reporting system for hazards or for identification of risk, and promotion really of that peer-to-peer mentoring for your staff, and overall again that regular communication is so important in relation to managing your risks. Now, this is a really interesting, again, piece of research about, I suppose, what can employers and employees do. Today, we're very much focused on work positive CI. And again, we are recommending that you do undertake a psychosocial risk assessment, and that will identify the risks for you. And Robert and Brian are going to talk about those more in detail. But just a nice bit of research I would like to draw your attention to, because I suppose a lot of employers would ask me, well, what can I do? How can I manage this? What are the preventative things that I can do for my employees? And I suppose my answer to this would be it's definitely multifactorial and would come from what the organisation can do and what the individual and the organisation can do, and very much broken down into three particular areas. And I suppose we're looking very much there under primary prevention. So very much like, how can I prevent it or mitigate these risks at work? So the organisation looking at the work content. It notes here fitness programs, but this translates from the research into what we would call employee wellbeing programs or occupational health programs. So very important to look at those primary prevention methods within your workplace. The individual and the organisation working together on their own skills within the job. So then we move then to that secondary prevention, which is looking at perhaps treatment or early intervention following exposure. So if you had difficult or stress-related environment, very much then improving that communication, that decision making, or having that conflict management process. So again, those secondary preventions, there could be peer support groups, coaching, career mentoring, career planning. So that's the secondary. Then the tertiary, I suppose, very much again, that tertiary is it involves more the rehabilitation side and to maximize ways really to manage that chronic stress that people can have. And again, that comes from the employee assistance programs and probably more extensive engagement with occupational health. So there definitely is a tiered process in relation to that. And then outcome measures are obviously noted there. So obviously, if we try and introduce all of these preventative measures, it should improve the working life balance for employees, and obviously then, I suppose, try and address those psychosocial hazards in a meaningful way for employees, and obviously lead to a happier work environment for everybody in relation to that. So thank you. That's the end of that, and I will hand you back to Aoife.
Great, thanks, Elaine, and thank you for giving that good overview there of really responsibilities of employers with regard to the management of psychosocial risks from a health and safety concept, but also from an employee wellbeing and the responsibilities under the Act. Next, I'm going to ask Brian to take the lead here, and he's going to present on the actual work positive CI tool. He's going to take you a very high level overview of it to give you a good understanding of what this tool can offer you in addressing some of those issues that Elaine raised. And just also, I should have said at the top of the meeting, we will have a Q&A session at the end of the presentations, of the formal presentations. So what I could ask you to do is, if you wouldn't mind putting your questions in the Q&A button there that should be on the top of your screen, and when we come to the Q&A, I'll then be able to direct them to the appropriate person. So as you're kind of going through the presentations, feel free to add those questions into the Q&A section. So Brian, I'll hand over to yourself now. So thanks a million.
Thanks, Aoife, and good morning, everyone. My name is Brian Larkin. I work as part of the Enterprise Risk Management Unit within the State Claims Agency, and we're delighted to be part of the webinar today as a stakeholder of the Work Positive CI initiative. And I hope you find this morning's session useful. Today, I'll guide you through the 4-stage Work Positive process. But before we dive in, I'd like to briefly introduce the State Claims Agency and our mandate as set out in the NTMA Amendment Act. So we have 3 core objectives. The first being to manage claims on behalf of the state. These are personal injury claims, third-party property damage claims, that are taken against the state, and our objective is to contain those costs to the lowest achievable level. These will be claims associated with slip, trips and falls, violence and aggression, manual handling, and of course, work-related stress. Secondly, we operate a, risk management mandate, and our objective here is to advise and assist our state authorities on measures to prevent future incidents that give rise to claims. So this includes supporting our clients on challenges like work-related stress and critical incident exposure. And we know that Work Positive is one of the most effective means of achieving this. Thirdly, we have a legal cost mandate, and that's essentially to manage and contain legal costs taken against claims to the lowest achievable level. So we have a mandate or a remit of 150 or so delegated state authorities, and these would include organisations like the HSE, the Irish Prison Service, the Defence Forces, Garda Síochána, TUSLA, and many, many more. And they operate in high pressure, high stressful environments. We know that incident reporting has increased, primarily down to probably a greater awareness to report the incident to their employers. But we do know that there's also, the risk is more prevalent there, and it's ever present within the work environment. These incidents can lead to claims, personal injury claims, and there's a cost element associated with any claim in terms of damages and legal costs. But there's also an indirect costs or a hidden cost that many organisations may not be aware of, such as loss of productivity, sick pay, absenteeism, staff replacement, and these can significantly outweigh the direct costs. Our research team carried out a study last year in relation to the indirect costs of a claim, and we estimate that for every euro you spend on a claim, you're spending another 80 cents on the indirect costs. So they can be significant when we look at the overall cost of a claim. In relation to work-related stress and psychological injuries, we know that the indirect costs are even higher, arising from long-term sick leave and the impact of those psychological injuries. This, I suppose, reinforces the need for a structured approach to risk management, particularly around psychological risk management. And this is where we know Work Positive can make a real impact for organisations. So what is Work Positive? Quite simply, it's a free online confidential psychosocial risk management process. It provides feedback on work-related stress, psychological well-being and critical incident exposure, and provides structured guidance to organisations to deal with these issues, including an online action plan that is confidential and unique to that organisation. And it's a collaborative effort of the Health and Safety Authority, ourselves and the State Claims Agency, WellHub and Critical Incident Stress Management Network Ireland. It was launched in 2017 by Ministers Pascal Donoghue and Ministers Pat Breen. And since then, it's been internationally recognised, utilised and endorsed. Last year, we carried out a significant upgrade to the website to, I suppose, improve that workflow, make it more user-friendly for users, increased and improved functionality around the survey, including exporting functions and more interface in relation to the survey results. And Robert will demonstrate some of that a little later. Why should you use Work Positive? Well, I suppose as Elaine covered earlier, there is a legal obligation to carry out a risk assessment, and work-related stress and critical incidents are no different to any hazard in the work environment. Ultimately, we want to improve workplace safety, make our workplaces safer. We know that stress can lead to burnout, anxiety, depression, and other mental health issues. We know that critical incidents can lead to long-term psychological harm, including PTSD. And ultimately, by using Work Positive, we're fostering and supporting a more resilient work environment. We know that it can impact on productivity and engagement in terms of organizational performance, decision-making, absenteeism, presenteeism. As I covered earlier, there's a financial impact, particularly arising from claims in terms of direct and indirect costs. So Work Positive is accessed through www.workpositive.ie. This is the landing page. It's designed to be simple, clear, and provides navigation to the 4 stages there on the top right-hand corner of the page. Each section covers, I suppose, a key element of the work positive process and guides you through the risk assessment. It is the most comprehensive risk assessment you can do when looking at this issue. And it is unique in that it includes an employee survey. There's a login page just to the top right-hand corner, and that allows you to create a unique account that is secure to you as the user of the website. And once registered, you can create surveys, you can add survey filters and disseminate these surveys across your employees. Robert will speak to this later. Today, I'm just going to talk you through the 4 stages and give you kind of a high-level overview of what each stage of the process involves. So Work Positive, I suppose, is structured and aligned with the Plan, Do, Check, Act risk management model. And as risk professionals, as many of you will be familiar with this, planning and preparing. So essentially recognizing the risk, identifying the risk, securing that buy-in from senior management, and setting out a project plan. The do stage, or the measure, is collecting and analyze data through an employee survey and other indicators of work-related stress or critical incident exposure in the workplace, such as absenteeism. The checking stage, or the action plan stage, this is where the organisation would review the survey results, identify areas for improvement and interventions, a targeted action plan dealing with specific issues outlined, but also highlighting and promoting that good element of positive feedback arising from the survey. And then the act, or the review stage, is implementing the measures and monitoring and reviewing as required. So prepare includes, I suppose, 3 key elements. First being to secure stakeholder commitment. Secondly, to establish a steering group. And thirdly, to decide which survey is most relevant for your organisation to run. So when we're looking at stakeholder commitment, really, it's really important that you have senior management backing, but also that you have buy-in from employees, employee representatives, and safety reps who will essentially be part of this process. In some cases, a business case may be required, setting out rationale on why we need to do this, in addition to focusing on, obviously, the element of there's a statutory requirement to carry out a risk assessment here, but also setting out issues that may be there in terms of incidents or claims. And the State Claims Agency is happy to support any of our client state authorities in generating that business case for your senior management team. Secondly, you will need to establish a steering group. This could be a group that's already there or functioning within the organisation, such as a Health and Safety Committee or a Wellbeing Committee. You may decide to set up a standalone Work Positive CI Committee. We recommend it to be between 6 and 8 employees, including HR, risk management professionals, maybe an employee representative. And that group will essentially guide, oversee, and support the process. They will develop a project plan, identify timelines for when it's best to run the survey, also develop guidance materials for your staff so they're fully aware and understand what this Work Positive project is all about. You will then decide on a survey option. So there are 2 options to choose from once you log into and register an account. The first being a survey capturing work-related stress, psychological well-being only. So that would include, as Elaine covered area, the areas of demands, control, role, relationships, support, and change as arising within the organisation. It also includes a wellbeing index, and Robert will talk to this later, but it's a combination of 2 validated tools, the PHQ-4 and the WHO-5 wellbeing index. Or you have a choice to run additional questions around critical incident exposure, which may be impacting employees. And just to talk around critical incidents briefly, what are these? Essentially, they are unexpected events, high stress, unexpected events that can cause, distress and emotional distress to organizations. And it could be, an issue around violence and aggression in the workplace, where there's an issue of an assault on staff. It could be fatality within the work environment, where your staff are exposed or impacted. It could be the death of a colleague or a service user. It could be, for instance, an unexpected suicide. It could be a security threat. And these can all have a very immediate impact and shock to individuals. They can cause anxiety, burnout, PTSD, particularly if there's a repeated exposure to trauma in high-risk professionals. It can impact productivity and obviously absenteeism, turnover, and potential litigation. There are secondary factors also to consider that can amplify those critical incidents, such as there could be high media coverage on a particular critical incident. There could be a social media amplification that can, I suppose, escalate public pressure. Or you may have employees with a personal connection to the incident or who may have known that individual quite well. So critical incidents can have a very significant impact on organizations. It's important that organizations have, when they identify these risks, they have a critical incident stress management program or similar in place to deal with those issues. So these are the two survey choices or options, as I mentioned earlier. These survey questions are accessible and visible on the website. So you may like to look at these questions in advance of rolling out, maybe as a steering group. They're available under the prepare stage of the process. So moving on to the measure stage, this is essentially where you will gather a lot of your information and data. You will, I suppose, first consider the employees and their roles, and like any risk assessment, their degree of exposure. You will run a work positive survey for perhaps a four week time period, and you may consider assessing workforce outcome indicators in conjunction with HR or other relevant stakeholders. So looking at employee roles, you may, for instance, have employees that deal with conflict in the workplace. They need to be considered. Are they exposed to critical incidents? Where are they based geographically? And you need to just, I suppose, consider their degree of exposure. There are very useful tools and resources on the measure stage, particularly looking at the area of critical incidents and what you might need to consider there when carrying out that assessment of employee roles. You will then run your work positive survey as agreed by the steering group. And again, there's ample guidance materials, including survey guidance in relation to invitations and text to use, and other useful information about running your survey available on the website. Separately, you may consider potential outcome indicators or indicators that may point to an underlying issue. For instance, if you have high absenteeism in a certain cohort of staff, that might indicate there's an underlying issue. You may have high staff turnover. You may see instances or claims arising to certain cohorts of staff. We would recommend looking at this data and potentially using it to measure performance. So when you do rerun work positive in the future, whether it's 18 months or 2 years down the line, that you've something to benchmark yourself against to see how things have progressed within the organization. The next stage is the action plan stage. So I suppose this is a crucial stage for, I suppose, turning those insights into meaningful improvements. You will review the findings of the measure stage. So your online survey and the results of that online survey are available through your registered account. And just to emphasize, the survey that employees complete is completely confidential. It does not gather any element of personal data. Survey results themselves, as I said, are accessed online. You then can create an action plan. You will obviously have an online action plan from the survey results, but you may have other actions and areas you may want to consider to include within your action plan based on the other elements of the assessment you've carried out. And then you will look to communicate the findings and planned actions back to employees, ideally within a 3-month period. The action plan is all about identifying the most critical issues. You may have a lot of positive feedback as well as part of the survey. It's really important that's captured and communicated back to staff. If you feel like you're seeing a lot of issues, it's important to prioritize, identify those high impact, high risk areas that require urgent attention. Develop, I suppose, objectives, priorities using the SMART, specific, achievable, time-bound objectives. to address and identify those risks. It's really important you have management commitment to back the action plan in terms of the areas that you wish to introduce and implement. For instance, you may have a lot of initiatives already running within the organisation. This may just be a tweaking of policy. It could be specific training for line managers, mentoring. You may need to look at your system frameworks and the programs in place to deal with staff and support staff, whether it's one-to-one peer support, whether it's group support training and policies around critical incident stress management. And as I said, you ideally need to communicate within 3 months of doing the survey high-level results of the priority areas for action. This could be a mix of a presentation, in-person sessions, or email communications to your staff. And as I said, it's really important to promote the good practice as identified in the survey. Finally, the review stage. This is all around, I suppose, ensuring that whatever actions you have taken up to now are effective, and that well-being continues to improve over time. So you're monitoring your action plan, you're monitoring those areas that you've introduced, but you also want to evaluate how do you know things are working, and I suppose adjust as necessary and decide whether further action is needed or required. Monitor your key KPIs around absenteeism, staff turnover, your incident and claim trends. Things haven't worked out, adjust your strategies, evolve your workplace policies. As I mentioned, celebrate success, because a lot of what you will do, you will get immediate impact and immediate success. It's really important to promote and reinforce that message of a positive impact. And consider rerunning the survey again in the future. It could be an 18-month, 2-year time frame. You need time to implement measures, to see how they're working, and then you may wish to consider rerunning the survey again. Many organisations and many of our client state authorities have done that, and it allows them to see how things have progressed within the organisation. As I said earlier, we're happy to guide and support and assist our state authorities in the rollout of Work Positive. We can be contacted through our email address, stateclaims@ntma.ie, and we have many more resources and materials available on our website at stateclaims.ie. That's it for me. Thanks, everyone.
Great. Thanks, Brian, and thanks for giving us that really comprehensive overview of the different elements of the Work Positive tool. Next up, we have Robert Kerr from WellHub, and he's going to give us an overview of kind of understanding the survey and the results when they come back, and addressing some of potential challenges or barriers in the action planning phase. So Robert, I'll hand over to yourself. Thank you.
Great, thank you very much, Aoife. Hi, everybody. I'm Robert Kerr. I'm a senior lecturer at Ulster University, and I've kind of been involved with the Work Positive process from an academic perspective, as well as a technical perspective. So as an academic, I've been involved with the development and validation of the tool since 2012, I think it is. And from a technical perspective, I've been involved with the spin-out company WellHub from Ulster University. That is the company that's developed the web platform online. So this brief session, I want to maybe dive a little bit more into what the survey actually measures online, the kind of reports that you can access, the benefits of those reports, as well as maybe touching on some of the barriers or issues that might stop us from taking the whole Work Positive process forward within our organisation, and some recommendations about how to overcome some of those barriers, as well as some very brief case study videos as well. So again, as we touched on previously, the whole purpose of the Work Positive CI process is to identify where best to allocate managerial resources to improve employee working conditions and tackle workplace stress. So the main approach or process we use to do this is through an online survey tool that takes 10 to 15 minutes to complete. And depending on the version that you select, it will measure workplace stressors, employee psychological well-being, and potentially critical incident exposure as well. So I'm going to dive into each of these areas, as well as touch on the reports and the information you would get as a consequence of deploying the survey within your organization. So workplace stressors really looks at psychosocial working conditions that research has repeatedly demonstrated that, if not managed well, can have a detrimental impact on the well-being of your staff. And these kind of broad areas are grouped into 6 sort of key themes, such as demands, the level of workplace demands placed on employees within your organization, the amount of control that your employees have over what they do at work, like what they do and when they do it, the level of support your employees feel that they receive from both peers, their colleagues, as well as their managers, the quality of relationships within your workplace. Are they absent from any kind of harassment or stress, the level of bullying, etc. that might happen. Role and how well your employees understand the role that they play within the organization, as well as maybe their broader departmental role as well, and their perception of how change is managed and communicated within the organization itself. So research has repeatedly demonstrated that these kind of key areas of work are related to not only employee work outcomes, but also their level of stress within the workplace. Now, there's a very interesting scoring mechanism we use to determine whether or not your organization is performing well in these areas. And we score using a benchmark system where we compare your organization's performance in the survey with other Irish-based companies that have taken the surveys previously. And then we kind of color code you and categorize you depending on how well you score in comparison. So, for example, if your scores in any one of those areas was in the bottom 20%, you'd be scored color-coded red. If you were just below average, you would be amber. If you were blue, it means you're above average, and green would indicate that you're in the top 20%. So the whole purpose of this system is to identify how well your organization or department is performing compared to other Irish organizations. And benchmark scores are very important. Now, because a per score in an area would help identify if there may be an issue and there may be an opportunity for improvement. Now, again, just to highlight how important the comparison score element is, the scores for all 35 questions and the 6 sort of key areas are all compared separately. So if you were simply to look at the scores individually, you might think, for example, well, your demand scores are very low and we need to address those, and it's a priority area. Now, in reality, every survey that I run, demand scores pretty much the lowest across every organization. So it's not just a case of where you score lowest, it's where you score lowest in comparison to other organizations, sort of a societal benchmark. So for example, we might realize that our demand scores are low, but compared to all these other organizations that have taken the survey before, we actually score higher when we're in the green category. That would highlight to us that actually, compared to other organizations, we're actually performing well, and this might not be an area that we should focus our attention on. The context is incredibly important, and the comparison is incredibly important to determine whether or not we need to focus our managerial attention on something and how likely that managerial attention or resources might help us to improve in those areas. To help as well, for every area that you score amber or red, below average, structured guidance is provided for each of the area and individual question results to help identify how you might improve. Also, just to highlight, though this is primarily a risk assessment process, the whole work positive term itself sort of highlights that it's actually kind of more broad and inclusive, and the survey will identify areas that you're green and their actual strengths in. So pretty much every organization I'm involved in will usually identify a few areas that they're actually really strong in, and that presents an opportunity for you to identify ways to leverage that strength, or even to learn about why that department or area are particularly doing so well. And maybe we can disseminate that best practice across the organization and learn from it. It also measures psychological well-being of your employees, and it uses a combination of 2 kind of well-researched and validated tools to measure the risk of anxiety and depression. This involves the PHQ-4 and the World Health Organization's WHO-5 Wellbeing Index. So these tools have been used multiple times in clinical settings to determine the risk of anxiety or depression an individual may present. We use these tools as a combined method to determine, using clinical scoring thresholds, whether your employees or your respondents are in the green positive mental health category, which means they are flourishing, whether they're amber, that there may be a risk of low distress, or whether they score in the red category, which indicates that the individual is presenting with high distress and low mental health, depending on their results. Now, the benefit of running this assessment alongside monitoring psychosocial work conditions is that it not only validates whether or not those psychosocial work conditions are going to relate to mental health of our workforce, but this tool can also be used to identify elements of the workforce that are presenting with poor mental health and maybe we should target on to try and help improve. Also, it identifies areas that will be flourishing that are in green positive health. And again, it's like we always tend to go in to look for the worst, the risk areas, but we'll also identify positives in there as well. And there are things that we can learn from and very much take forward as we develop our action plans as well. Finally, if you selected the critical incident version of the work positive process, it will also explore the frequency and scale of experiences of critical incidents that are encountered within the jobs that your respondents have and their perception towards support measures. So this is very useful to try and get a real read of the level of critical incident exposure within your workforce, as well as the type of support measures that may be most helpful as determined by the people experiencing those critical incidents themselves. So it gives you a good read on the situation, as well as mechanisms that we could take forward to improve the situation as well. So all of these areas are measured through your survey, which you create online. Once you have registered for an account, you can, every time you log in, you'll go straight to this sort of My Surveys dashboard area within the online platform. And it's very simple to use. To create a survey, you simply click on the Create Survey option, select which survey you would like to use, create a title, indicate the number of people that you would you plan to target with the survey, and then you're good to go. Your survey will appear in this table. There's 2 surveys I've created here previously. And as soon as it's in the table, it presents information on the status of the survey, when it was created, and the number of responses. So it'll dynamically update every time there's a response. It'll show on your online survey. I can also delete a survey as well. To distribute my survey, I simply click on this option and it will take me to a screen where it presents a web link that I can share with my staff online to take the survey. It even gives me email content to share with that link so that I can introduce the survey and encourage them to take it. There is an option to print your survey in a paper format and administer it in that format as well alongside. And that's it. We distribute our survey. We can also add a filter, which is very useful. So once we have a survey and before we have any survey responses, the add filter option will appear in the table. And that allows us to add sort of filter categories. So how would we like to slice and dice our survey results? So for example, we might want to have an overall survey, but we might want to consider how different departments, geographical areas and locations, or even different job roles respond in the survey. You can add as many filters and filter options as you want to your survey, as long as you haven't got any survey responses. So before you launch it, you can add it in, and then you can use those to kind of cross-compare your results once you have them. Regarding results, as soon as you have at least 5 responses, you can access the Analyze Results option and go into your report section. You can't analyze any report that has less than 5 responses, and this is to maintain the confidentiality from any respondents engaging in the survey. So once we click on our Analyze Results option, we can see that here is an example of the work stressor responses. So this table, again, the screen provides a little bit of information around the number of respondents, the survey itself. To create a PDF version of any report within your sort of survey sections, you simply click on this option and it'll generate a PDF that'll instantly be downloaded to your computer. And you can see through here, for example, the first reports will break it down by the work stressor areas. And as we go into the areas themselves, it'll break it down by individual questions that are used to score your area reports. Now, again, as I mentioned earlier, for any question or area that we score red or amber, we're below average, we will receive structured guidance and feedback, detailing options and ways we could try to improve or take corrective action in those areas itself. So it's very much about giving you kind of a read in comparison with other organizations that have taken the survey, and also identifying ways that you can improve your working conditions. Once you add a filter, you can also compare your results for each of your filter categories with the overall results of your organization. So for example, in this report, we're filtered by Site A, the option up here I created. And once I click the Site A filter, it shows me the Site A results compared to the overall organizational results. So it can help me identify if we have any internal areas that are significantly different from our overall results, and then we can explore why that might be the case. Again, I've seen this function used in organizations to actually identify strengths. So you may have an organization that might have overall a below average result when it comes to manager support, but you may have a couple of areas that are actually scoring in the top 20% and really well. And they're obviously areas where we could go look at and explore and identify what it is that they're doing right. How come the perception of support from managers is so positive in those areas? So it's a lot of case of sometimes learning from the areas we're strong in and sort of formalizing those kind of good practices that we already have and making sure we share those across the organization and adopt them almost as standard practice going forward. These are all very positive things you can use the survey for, as well as do risk assessment for those areas and concerns. Your employee wellbeing reports, again, this shows you what is reported from the composite measure of the two kind of well-validated metrics used in clinical settings. So we can see from this report at an overall level that 14.1% of the workforce are at risk of anxiety or depression. The wellbeing measure is low. We've got a small percent of 14% at amber and a large 71% in green, indicating roughly 72% of our workforce are flourishing. Now, what's useful about this measure as well is we also provide the average for the Republic of Ireland results in this wellbeing measure. So you can compare your organizational or departmental or whatever filter you have results with the Irish societal average. Now, this is important because, again, it allows us to contextualize the impact or the importance of the findings. So, for example, if we had, in this case, say 14%, say we had 14% of amber, we might think, okay, that's a concern. We should focus on that. But we compare that across the societal average, we can actually see that these results are very positive. And this organization is actually doing quite well, or these results, again, it's very low numbers, but it's doing quite well compared to Irish averages. So it helps us identify, whether or not it's realistic for us to expect to improve and whether or not these are something that are out of sync of the Irish societal averages. And if they are, then that's something we should really take forward, because it really means that if we are lower well-being than all the other Irish organizations, there's obviously some reason for that, and there's obviously an opportunity for us to improve in that area as well. If you indicated that you wanted to take the critical incident version, you also you can access a series of reports highlighting the kind of exposure and intensity and frequency of critical incidents that occur to your respondents, as well as them providing feedback regarding what measures and support measures they think would be useful for them to deal with those issues. So that's in a nutshell your kind of reports. Highlighted some of the benefits as I went through, but I wanted to highlight some more, I think, key benefits of the work positive process as a whole. So a key thing is that the results and the tool itself have been validated within Ireland and also linked to important performance metric within Irish organizations. So for example, work stressors have been linked to mental health, job satisfaction, errors and near misses, alcohol consumption, etc. Lots of other kind of lifestyle indicators within Irish organizations. And even looking at the positive side, top scoring respondents with top scores in work stressors are over 20 times more likely to be mentally flourishing and engaged at work. So the survey is validated in Irish within the Irish context, and within Ireland itself, we've repeatedly found that the scores and results in this survey is linked to important performance metrics and work outcomes in Irish organizations. So it's valid and reliable within that context. And that's important to take note here, because not a lot of surveys necessarily are, and there's more research conducted in this and more results that we have found than a lot of other similar tools. It provides, similar to this again, meaningful benchmark comparison with other Irish organizations, and that identifies where everything else being the same, we should largely be in a line with those, and if we're not, then that clearly identifies an opportunity for improvement or development. It spots strengths as well as problem areas, highlighting areas that we're strong in as well as areas we might want to focus our attention on and could potentially improve, but also highlights hidden truths. So I've been running surveys for 20 years. Every organization that I've been involved with for the survey, they usually find things that are important that they weren't aware of before, and other things that they felt were important aren't at all. So it's a very important to realize you've got to ask everybody to find out what's actually happening within your organization. Otherwise, without using a survey, you're relying on individuals with the loudest voice within your organization to inform you of what's happening. And those individuals quite often don't represent the organization as a whole. So quite often what we think is a key issue that we need to address, until you survey and canvass the workforce, you don't know if that's actually true or not. And these tools, survey tools, can be very useful ways to do that and to really justify whether something we think is an issue is something we need to address or not. Structured guidance enables action plan development for any question that you score below average in the work stressors, which is very useful and important. And finally, probably most important, it's free. It's a free online validated tool with clear links to performance metrics in Irish organizations. In fact, it's been used by a number of organizations to help them provide strategic direction on their health and wellbeing strategy going forward. So it's free, it has all these positive impacts, and it's clearly something that we should be embracing as organizations going forward. But what's stopping us? Well, again, in my experience, there's a number of different things that have cropped up that naturally tend to act as barriers towards engaging and taking the work positive process forward within organizations. Some are relatively minor, like timing issues. We're running surveys within every organization, and it's hard to find that sort of gap between all the other organizational surveys we're running to run the work positive. On the flip side of that, the survey is 10 to 15 minutes to complete, and pretty much any organization that wants to will find time to run the survey. Survey fatigue is very clear and present danger to organizations when it comes to employees engaging and getting a response to their surveys. However, from my experience and borne by research as well, survey fatigue is most commonly an issue whenever we repeatedly run surveys that don't have clear consequences of that survey having been run. Basically, there's very little feedback and there's very little action as a consequence. The work positive survey has clear actionable feedback provided for anybody scoring below average in the work stressors, and that allows you then to take action going forward to show that this is a survey that has had a consequence. As long as you have surveys with consequences, you can basically get away with running as many surveys as you want in the workplace, and survey fatigue will not be an issue. Technical issues are sometimes put forward. However, you'll find that the web platform is incredibly easy to use. There's help files, and information and guidance at every stage of the process, and we're also on hand to answer any questions you might have regarding its usage. Data concerns sometimes come up, and increasingly so regarding larger organizations. Your survey results are completely confidential. No state body or anybody else can access your survey results unless you specifically request from us that we want them to do so. We are fully GDPR compliant. No individual respondent will be identifiable at any time with your survey. We don't even ask questions that allow us to work out who an individual survey respondent is, and you cannot access any report that has less than 5 respondents. So we take this element of confidentiality very serious because we understand the sensitive nature of the survey from an organizational context, and feel and understand how important it is that you're able to be honest with yourself, deploy the survey, and use that information in a positive way to go forward, and it's not another body coming in to look at it or monitor it for compliance purposes at any stage. Finally, probably the biggest issue coming up is this idea of the elephant in the room. From my experience, there's always senior managers that are concerned with what may be uncovered and how we might manage what's uncovered with the survey. But I would always kick back to say that ignorance is never a solid basis to develop a strategic strategy going forward, or HR strategy going forward. And unless we can fully understand what our employees are feeling and how they perceive the working environment, we aren't in a solid basis, or we don't have a solid foundation to kind of plan any kind of improvement. So without shining the light, we don't even know that elephant is real. I have run multiple surveys in organizations where what they thought was a key issue turned out to be something that only a few prominent individuals were putting forward and wasn't felt by the workforce. So it's only through clarity and understanding and getting a real read of the situation can we determine how best to take things forward. So it's this idea that the survey is something that we need to do when it comes to sort of ascertaining actual employee perceptions of the work environment. Another issue related to this is what if we have lots of red, things flagged red on the survey, and how do we take that forward as a paralysis through potential negative feedback? If you're concerned about lots of reds, I would highlight that the whole work positive process is about simply identifying where best to allocate organizational resources to improve working conditions. If you have lots of reds, our suggestion would be simply identify a few things that you think you could action and take forward within the next 12 months and focus on those and put the other things to the back burner. This is not a one-off stop. The idea this is a long-term commitment and focus on continuously improving working conditions. So our advice when you get a lot of things flagged is just focus on what you can do in the short term and get those quick wins. Once you have some successful wins or improvements under your belt, you'll find there's a lot more momentum and engagement from the organization to continuously developing and improving and going forward. This is not viewed as a stick to hit people with. This is something to help people and organizations identify the best way to improve working conditions. And on that mind as well, we actually say, even though we color code things red and amber, we do not suggest that you sort of disseminate those color codes anywhere in your workforce beyond senior management. They're simply areas to flag where it might be useful for you to focus on as an organization to improve things. But we're keen to say, look, when you report your findings, we actually encourage you just to highlight the areas that you think you'll focus on going forward and what actions you're going to do as a consequence. This is very much about key points of concern and what we can do to improve and what we plan to do to improve the situation for our employees. And with that in mind, is kind of feeding back into this idea of how do we secure senior management commitment. Being honest, there's always a senior manager that's very concerned about what the survey will uncover, and that's fair, that's legitimate, it's something that'll always happen. However, I think it's important when you try to get that engagement is that you really highlight the fact that results are confidential, things are color coded, but they'll not come back. They're like the senior management team, and that like no body or nobody else can access your results. At the very most, we encourage you to flag, but it's up to you permission to do so when you create your account, whether we can use your results to update scoring norms. But anything that we do with your results, they are fully anonymized before they're taken forward. So we can't even identify the company or individuals. They are completely confidential results. Another thing I'd encourage people to do in their organizations when trying to take things forward is to try to move beyond this compliance and risk management approach to taking, putting it forward to organizations and focus more on the broader idea of improving employee well-being. As I repeatedly mentioned, the survey will identify a number of strengths that are present within your organization. And as you go forward, it's about identifying things that we're doing well, as well as identifying areas for and opportunities for improvement. And even the things that we're doing well, it could be a case of like identifying how we're doing that well, celebrate that, learn from their approaches, and kind of spread that to the areas that maybe could learn from it within the organization itself. So every organization that is really engaged in the process in a very productive way that I've found has very much reframed the overall approach as not just risk compliance or dealing with that risk element. It's something we could use to identify opportunities for improvement for employee well-being across the organization as a whole. That reframing, once you take the risk idea out of it, automatically starts to increase engagement from definitely the HR side of things as well, because we're looking at things well-being strongly related to engagement, performance, productivity of employees as well. So next steps, which we'd hope everybody would be in a keen position to do. First of all, register for an account online and work positive if you haven't done so. Get into the site, play around a bit. Once you create an account, it'll automatically create a demo version of the survey with 20 responses. And that's to allow you to go in and look at the results and get a feel for them. And if you have any questions, you come back to me or any of the team and we can take those forward. Also, I would focus on starting to secure a senior management commitment for the survey rollout in the next 12 months. Again, you're looking at developing the business case, mitigating any of those concerns that managers may have, and just trying to take the whole thing forward. And again, there's clear benefits. It's free. There's basically no reason why and again, research is linking these findings to important performance metrics in Irish organizations. So from a business case scenario, it's a very, very strong case for this is something we should all be doing within every organization. It's those fears of what the survey might uncover it's really stopping most of us from taking it forward, or creating managers who resist it from rolling forward an organization. So it's a key area as we go forward, securing management commitment is trying to identify ways to mitigate some of those concerns and fears people may have. And thank you. And just to remember that we're also on hand to provide additional help and support if you need it. That's my academic email address. If you have any kind of academic queries around the survey and the validation of the tool itself, feel free to get on board. But before I go, I'm just going to play two quick, very brief videos from two organizations that have previously engaged with the process.
My role in the prison service is to look after staff that have been involved in a critical incident. The prison service can be a very demanding and stressful place to work in. The staff are dealing with prisoners that are coming from a variety of backgrounds. On top of that, then there's times when they're dealing with critical incidents, and that would include the likes of assaults on staff, assaults on prisoners. So when the staff come across those type of instances, it can be very traumatic for them and very stressful. So the Irish Prison Service have been kind of very aware that this kind of situation is happening and that it is very stressful for staff, drains on staff. So we use the Work Positive survey tool to gauge what stresses and strains were on staff. So using the results from the survey, we started putting in packages to help staff following critical incidents. It was through the Work Positive critical incidents that we were able to now quantify what the issues are with staff, and we can then start to see is that our interventions working, or what we need to work on to better make it a safer environment for staff to work in.
Okay, that's Irish Prison Service. I'm just going to quickly play another client. This is Eli Lilly.
Through our Live for Life wellbeing programme, we want to ensure that we provide a holistic, integrated approach to our employees' health, safety and wellbeing. Our programme motto is live safe, live fit, live healthy, live well. At Eli Lilly, we are committed to investing in the physical and psychological health and wellbeing of our employees. We looked at different methods and tools available to assess workplace stressors and employee wellbeing, and we decided to use the Health and Safety Authority's Work Positive tool. It made the process a lot easier than developing our once-off survey or buying in expensive alternatives. We used the tool across the Kinsale manufacturing site, customising it to meet our needs. We consulted widely with management during the report review process and used the results to implement tailored changes based on employee and area feedback. The report allowed our management and employees to be part of the solutions. Work Positive was very well received. Engagement was high, with over 90% response rate. We will continue to use it as well as other tools because we believe that it met our needs, and we are committed to investing in the well-being of our employees over the long term.
Okay, that concludes my section. Thank you very much, everybody, for listening.
That's great, Robert. Thanks a million. And thanks for giving us a great overview and insight, I suppose, demystifying somewhat the findings and the results and how they can be interpreted, and then looking at some of the challenges and how to address them. And it was great to get those two videos, two very different organizations, one in the public and one in the private sector agencies that have been able to utilize the survey both for their needs. So listen, I just want to say thank you to all our speakers for their insightful presentations this morning. I hope the session has provided you all with kind of actionable strategies for assessing and managing psychosocial hazards and risks within your organization, and a good understanding of the Work Positive tool, and hopefully it's kind of given you, I suppose, that invitation really to check it out further and to come back to us with any information or requests that you have on it. So for more information, we have Work Positive. It's www.workpositive.ie. That's the website. There's a link on all of our agency websites as well to it. There will also be a recording of this webinar along with additional resources. Elaine mentioned that, which will be shared with you after the event. And also we'll be running further webinars throughout the year on managing psychosocial risk, but also other occupational health hazards and risks from the health and safety perspective. So really invite you to kind of check out our website and sign up for updates for that. And as I say, we're here to provide support and guidance to employers as they go through the journey of work positive. So any further assistance that we can be, please reach out to us as our subsequent after this webinar. So really, I just want to thank you all for attending today, and to thank again our speakers for their great presentations. So thanks for that, everyone. Thank you very much. Bye now.
Thanks, Evie.
Thank you very much.
Thanks, everybody.